I'd like to share and take you into a look into Kevin Durant's Achilles tendon injury. The MRI still hasn't come back, so there's no definitive extent of the injury, but I can tell you from what I've seen, it does really look like an Achilles tendon rupture. So I'm Dr. Rob Silverman, Amazon best-selling author of Inside Out Health, ACA Sports Council Chiropractor of the year 2015. There are 5 different types of Achilles tendon injuries. Number 1, we have what we call Achilles tendonitis. That tendonitis is an irritation. There are inflammatory cells there. It's acute. It's typically something that's early onset. We also have Achilles tendinosis. Achilles tendinosis is very interesting in that there is some degeneration and you've had tendonitis for a duration of time, so you call it tendinosis. You have tendinopathy, which means there's a pathology to the Achilles tendon. The 4th type is an Achilles tendon tear. So there's different extents of a tear. Most people think tear and rupture, torn, are the same thing. They're not. So there's levels of a tear. What I think when Kevin Durant got injured, they used it and described it as a calf injury. And I'm going to discuss that. But the tear could mean a small tear. It could also mean a pretty extensive tear where the Achilles tendon is still attached to the calcaneus or the heel. And last but not least, an Achilles tendon rupture where the tendon has ruptured off the calcaneus, i.e. the heel bone. The Achilles tendon is the longest and strongest tendon in the body. It's made up of 3 muscles. Tendons are muscle getting short and tight into bone. That Achilles tendon is made up of 3 muscles: the gastrocnemius, the soleus, and the plantaris, if you have one. They become thin, they become fibrous, they become tendinous, and they form the Achilles tendon. So when it was said that he had a lower calf injury, and where he was pointed to in his initial injury in the semifinals against the Rockets, it was very apparent to me that he had also damaged the Achilles tendon. So when he went out and he played, that tendon injury or that injury to the lower calf, it made him more susceptible to an Achilles tendon rupture. But that's not what we're talking about, not whether he should or should have not played. What we're talking about is the anatomy. Remember, the largest and strongest tendon is your Achilles tendon, made up of those 3 muscles in your calf. That takes care of the different types. What are the tests? Well, it's a Thompson test, and anybody can Google it. You lie face down, you bend your knee, and you grab the calf. If you still plantar flex, which is one of the actions of the Achilles tendon, if you're able to plantar flex, it means that the Achilles tendon is still attached. Now, interesting, using him as an example, he knew that he had dysfunction, but the pain didn't look so bad. That usually implies, believe it or not, a rupture because it's not attached and you don't have your nerve endings attached to the bottom of the heel. The people that I've seen that really scream and they kind of act like a fish out of water because it's a horribly painful injury if there's a tear, but there's still an attachment. So the Thompson test is a great test, very easy, and obviously they're waiting for his MRI results. There's a plethora of different reasons why you may have or what may cause an Achilles tendonitis or Achilles tendon injury. I use 6 that pertain to Kevin Durant. It's in the news right now. Incidentally, he's not the only well-known basketball player. It's very common for a basketball player to injure his Achilles tendon. Somebody else very famous like Kobe Bryant, Dominic Wilkins, etc. have also had Achilles tendon, but injuries, tears. DeMarcus Cousins, who also plays on the Warriors, also had it. Pushing the body too fast and too soon. So pushing it too soon, too fast, increasing your workload, coming back from injury too soon, trying to do too much too soon can lead you down a path of an Achilles tendon injury. In addition, a sudden increase in activity really segues back to the first one. So if you're somebody who has ran 8 times up a basketball court and now decided to run up 80 times, clearly that increased activity will put a strain on your Achilles tendon. Your Achilles tendon is a stress disperser. So it disperses with stress. It's very common. It's used a lot in running, jumping, and cutting. A little hidden thing that I want to share with everybody, a lot of people who have an Achilles tendon injury also have a plantar fascia injury. In 50% of people that also had a plantar fascia injury also had a damage to the Achilles tendon, or should I say the paratendon. So before we go any further, the Achilles tendon, all tendons have a tendinous sheet above it. The Achilles tendon is extremely unique because it's in another tendon, and that tendon that it's in, this is your Achilles tendon, it's like this here. This is what we call our paratendon. That paratendon communicates with the plantar fasciitis, and when you damage your paratendon, you also have plantar fascia injury because there's a fascial attachment that goes with it. So injuring your Achilles tendon, in the recovery when we talk about it, you're also going to have to take into consideration a plantar fascia and a paratendon. Sports that have quick starts and stops. Basketball, having played it, it's a quick start and stop. You saw he drove when he got injured. He planted his right foot and he tried to go up for a jump shot and the tendon gave way. Injury to the Achilles tendon, clearly that's very common if you had Achilles tendonitis, and injury to the paratendon. Tight calf muscles. Now I can't validate. He's got a thinner lower body, Kevin Durant, but I can't validate if his calf muscles were tight. But probably he had that calf injury. Everything got adhesed, and there was some fibrosis going on. So he probably did. We don't know for sure, but most people who have Achilles tendon injuries have tight calf muscles. And last but not least, flat arches or overpronation. He could be, or most people are, too pronated. They're too pronated. It stretches the tendon, so you're already in a stretched position, and then you go to utilize it even more, and it's quicker to tear. Managing the injury. Interestingly enough, there's 2 exercises once it's attached, or if it's still attached, that they do. Number 1, it's called an isometric heel rise. So if this is your foot, you're lifting your foot up. So literally, you're standing on a stair, and you're lifting your foot up and you're holding it for 3 seconds, isometric. You're allowing everything to contract. Where the opposite, having the same positive effect, you are now doing a heel lowering. Many people like to do the heel lowering. They like to do it on a leg press. I like to do it on a stair. The heel lowering is actually lengthening the tendon, which is eccentric. Eccentric means lengthening a tendon or muscle. By lengthening the tendon or a muscle, you're leading yourself down a path to muscle hypertrophy or tendon hypertrophy, allowing it to knit and allowing collagen to lie down. Now, what I would do if someone had Achilles tendon, assuming that it's either attached, hopefully, or have just been surgically reattached, here are my treatment protocols that I like. Without question, exercise rehab. We do a lot of eccentric stuff here. ChiroUp's got a great little blog on it, written blog. I recommend it strongly. Brandon and Tim do a great job. In addition to that, in addition to the exercise, I'm a big proponent on strengthening the calf muscles and anything in the lower limb. I use a lot of low-level laser. Low-level laser has been shown to help healing, allow collagen and fibric proliferation, to allow collagen to heal. So you get this parallel collagen laying down and allowing the tendon to heal, and nutritional supplementation. So my favorite nutritional supplementations would be different supplements. My supplement of choice would be something by Nutridyne called Chondro Joint Aid. It's a 4-in-1 formula, all pointed at soft tissue and joint healing. In addition to that, PRMs, pro-resolving mediators, which will decrease the inflammation, allow inflammation to resolve. Therefore, inflammation will not be resonating for too long a period of time and not allowing the areas to heal. And believe it or not, omega-3 fish oils have really been shown to help soft tissue injuries heal. So exercise rehab, proper nutritional support, and low-level laser. If you have any questions, feel free to reach out. We're going to do some future blogs and videos on sports injuries. Dr. Rob, always yours in health.